This is our MMP Benefits Committee, and we have a fantastic presentation coming from AudioNet on a new benefit that's going to be available to us. And Randall, if you would kindly handle the introductions for your team prior to the presentation, I will go ahead and now mute.
Thank you so much, Terry. Hello, everyone. I am Randall Dervishi. I'm the Senior Account Executive here at AudioNet America. And with me today are two of my team members, Rebecca Wagner, who is our account manager, who we will probably be working with on a day-to-day basis, and our CEO, Colleen Shefferly. And that's our entire team here that's on the line today.
Good afternoon, everyone. Terry, I'll go ahead and start. I just want to make sure everyone can hear me before I continue.
We can definitely hear you. Very clear.
Okay, great. Thank you. Okay, so we welcome this opportunity to have an opportunity to present to the City of Spokane. And we do have our screen here up on the, slides up on the screen here. And we will also share these with you via email so you can share with any of your membership electronically. So I'd like to start by saying that AudioNet is a national hearing benefits manager, and we're driven by care, not by unit sales, which is very important. The majority of our competition is owned by hearing manufacturers, and AudioNet is focused on helping the city manage the overall health care of their members through, with our portion being managing the hearing specific. We are a national benefit and a national network. We follow a managed care model, very similar to an HMO or a DMO. We have various provider networks. The network that we are utilizing for the City of Spokane includes both audiologists and dispensers. We are a licensed TPA, which means that we have fiduciary responsibilities. Our main focus is on member care, and we are licensed in the states in which we are doing business, and we follow NCQA and CMS and URAC guidelines in doing so. One of the things with our program is that, again, unlike some of the competition, we offer all manufacturers, or the majority of the national and global manufacturers in the industry, and I'll show you who those are in a few moments. AudioNet America was created in 2007 for the auto industry. We started with Ford, GM, and Chrysler, and from there we broke out and started marketing to other employer groups, unions, Medicare Advantage, Medicaid, and other governmental entities. So we have a background in all segments of insurance and the labor industry. Hearing is being utilized currently and in some cases being packaged with dental and vision. And the reason that we have this on the slide is to show the importance. Years ago, hearing used to be a benefit. And during the bankruptcies in 2008, a lot of employer groups got rid of hearing and dental and vision. And then after the economy got back on their feet, they brought these entities back into play. I think from my own personal experience of 40+ years, I think you're going to see these benefits stick around for good now, because they are being more and more tied to the medical insurance plan as well. And I'll explain to you what that means in just a moment. But to give you a little background on hearing healthcare, the utilization in hearing is going to continue to grow, and the need to manage the benefit will do the same, especially with the baby boomers in the industry reaching the age where most hearing aid wearers begin wearing devices. But what you're going to see also in the industry is that more and more people will start wearing devices at an earlier age, because of all of the, unfortunately, the technology that we use is in fact damaging our ears at a younger age. So we're going to see the population or the age population decrease as we continue to move forward in hearing healthcare. But to give you an example, adults age 20 plus with hearing loss are projected to rise from 44 million by 2020 to 73 million in 2060. Again, that's just age 20 plus. 1 in 14 ages 39 to 53 already have hearing loss. And that's just for individuals that we know that go get that base check and get monitored. We really encourage people to go get an exam earlier so that there is something to use as a base as they continue to grow older and monitor that variance for their specific needs. Ages 65 to 74, there's a 3 in 10 chance that an individual is wearing a hearing device or has a hearing loss. And ages 75 plus, 1 in 2, or 50% of that population is in need of hearing devices to help reach that specific level of hearing acuity for themselves. The impact of hearing loss is estimated to be more than $100 billion annually. And again, this is going to continue to grow. As I mentioned earlier, we believe that hearing will be around for good now because unlike, or similar, I should say, to vision that has correlations with diabetes and heart-related occurrences or cardiovascular disease, the same is the case in dental, and we are finding now the same to be the case in hearing. And here is a list of a few of the comorbidities that are being associated with hearing loss. Social isolation and loneliness, you're up to 7.5 times greater risk of having a hearing loss if you suffer from this illness. As well as depression, there is more of an increase if you are suffering from depression in having a hearing loss. Certainly slip and falls can be attributed or have a comorbidity along with hearing loss. Cardiovascular disease, diabetes, and cognitive impairment. Cognitive impairment has been a huge healthcare issue that is on the books right now and being studied vigorously in the hearing industry. What we are finding is a correlation with dementia, and we're also finding that some people are being diagnosed with dementia that may in fact just have a hearing loss, but have a lot of the same symptoms as far as social isolation. And so again, this is a medical condition that is going to continue to be monitored and tied back to other medical comorbidities. So because of that, we feel that the healthcare plans and the employer groups realize the need to continue to offer hearing benefits on an ongoing basis. The difference with AudioNet and our competitors is that we were the first in the industry to have no billing. So our pricing is negotiated on a national level. And other than, well, this is a voluntary program. So other than the prices that we will be showing to the membership, our providers or doctors in our network cannot charge your members anything more than what we have on our benefit summary. So if for some reason someone were to be charged more, they have recourse by calling AudioNet, and we have contracts with these providers that prohibit them from doing so. So we have recourse with the providers to make sure that they fall within the contractual arrangements. We do have various provider networks to choose from. As I mentioned, we will be using both audiologists and dispensers for the city of Spokane. Provider accountability on product, service, and price. Again, this gives your membership an opportunity, if they are dissatisfied in any way with the provider or their product, they have somewhere to go besides going back to the provider. They come back to AudioNet, and we will assist them in making sure that they have 100% member satisfaction. We offer benefit terms for 12, 24 months, and 36 months, 60 months for Medicaid only. For the City of Spokane plan, this will be a 36-month benefit. Again, we offer the top 6 manufacturers with all product levels. We have a claim cost savings of over 48% over the market price in the MSRP or retail industry for hearing devices. And another thing, during that 3-year period, we will also warranty the devices as well as pay for a one-time loss and damage. So literally, if your dog eats your hearing aid, we will replace that hearing aid one time in that 3-year period at no charge. We are totally transparent, so we will be, our pricing is our pricing. Again, it's negotiated nationally, and the members will see the pricing before they even go into the provider's office. All in all, AudioNet's main philosophy from day one is that we are a hearing benefit administrator driven by care, not by unit sales, and our overall goal is to make sure that the members are 100% satisfied. What you'll see here now is an example of, I'm sorry, is this theirs?
Yes, I put our
Okay.
information there.
This is a sample plan design, but it actually is the City of Spokane's plan design. And I'm going to run through that very quickly here, just give you an idea, but you can refer back to this benefit summary at any time. This will also be online on AudioNet's website by simply entering in your membership number or signing in and logging in, and we'll give you access to the City of Spokane benefit summary. Your plan will cover an examination at 100% after a $50 member copay. So there is a member copay of $50 for the examination. If you choose to go through with services, you will then be charged by AudioNet, and we will work with you via the phone to secure payment for the devices. But if after the examination you decide not to move forward on purchasing hearing devices, your only charge will be the $50 copay for the examination. After the examination, the provider will have a discussion with you on what your hearing loss level is, and you will decide whether or not you want to move forward. If so, the provider will conduct an evaluation test, which is a little more extensive of the examination, and it determines your individual level of hearing loss so that they can properly order the devices based on your individual prescription. The hearing devices will be paid at the following levels. There are 5 levels of devices in the industry. We do not use the low or entry level in this plan. So we will start with the mid-level device, and the cost, inclusive of all of the services that are on this benefit summary, will be $1,000 for one hearing aid or $2,000 for 2. Under a mid-high level device, which is an upgrade-in device, and we'll go over all the product levels with you after this, towards the end of this presentation. But for a mid to high level device, you would be looking at a charge of $1,250 monaural, or for one hearing device, $2,500 binaural, which is 2 devices. Then if you choose to go to an advanced level hearing device, the charge would be $1,500 or $1,500 monaural, or $3,000 binaural. For a flagship device, which is the highest level that you can go in the industry under this program, is $1,650 monaural and $3,300 binaural. To give you an example, in the retail market, a mid-level, which we are charging $1,000 for, generally goes between $1,000 and $3,000 in the market. And a flagship level device, which we are charging $1,650 for monaural or $3,300 binaural, a set or 2 devices of flagship hearing devices in the industry can go anywhere from $7,000 to $10,000. So you see, as you go up in the device levels, the savings becomes greater and greater. And again, these savings this is our pricing on a national basis. And so whether you're purchasing on the west side of the city or the east side of the city, the pricing is going to be the same at every AudioNet provider that you go to in network. These costs will also cover the dispensing and the programming of the hearing devices. The pricing also includes a conformity evaluation, which is a follow-up test after the devices have been dispensed, to come back in, make sure that they've been programmed appropriately, and make sure that the member is satisfied with the level of hearing that they have achieved. In addition to the hearing devices, ear molds are covered for adults at one time at dispensing, and then there are additional ear molds covered for children because the child is constantly growing and the size of their ear canals and that are changing. So we have additional ear molds for children throughout the 3-year program. Again, ear molds for individuals over the age of 7, you would receive 1 ear mold with each hearing device at no additional charge. We also will cover your first year of batteries for each device purchase, 48 batteries, which is basically a year's supply for each device purchase. And then thereafter, you can purchase the batteries at any pharmacy. You can purchase them at your hearing provider location, or you can order them online. Maintenance and fittings. This is a great benefit here in that a lot of providers will charge anywhere from $100 to $200 for follow-up visits. And then people get very frustrated because they don't want to pay that fee. And so they may wear their hearing devices for 6 months and then become frustrated and throw them in the drawer. We've been able to negotiate a $20 copay for the entire frequency. So the first 6 months is covered at no charge, and you can go as often as you'd like to the provider's office. Some people will go once, some people might go once per month, but that's covered in full at no charge. After 6 months, and for the remaining 30 months of the 36-month frequency, you will be charged $20 copay. That's a cap. These in-network providers cannot charge any more than $20. And then you'll see in the fine print here, it refers to that you must use an in-network provider if a provider is within 25 miles of your home. Again, very similar to an HMO or a DMO or dental program. If we do not have a provider within 25 miles of your home, then you contact AudioNet and we'll arrange to work with you to either sign a new provider, try to get the provider to accept our fees, or if we cannot find a provider, we will pay, you have the opportunity, I should say, to go out of network, but we have no contractual arrangements on what the provider can charge you. So it's really in the member's best interest to try to work with AudioNet to obtain our pricing. AudioNet's business model, just so everyone knows, we work in all of the following business entities: commercial book of business, Medicare Advantage, Medicaid, Voc Rehab, which is governmental programs. And again, we work with both an audiologist or an audiologist and dispenser network. And so for the city of Spokane, it will be audiologists and dispensers. Again, we have a very robust network, which Rebecca will show you after I'm done speaking on the presentation here, where we have access, and I have to get you the number for City of Spokane, but we know that we have tremendous access in your area, and we'll be able to show you the provider network after this presentation. We have a fully credentialed provider network, which means that, again, they have to adhere to our contractual arrangements, to our pricing, and if there's any problems with the provider, the member simply calls AudioNet and we will iron out any problems that a member would have with the provider because we hold the contract directly with the provider. We mandate state-of-the-art products, so our providers have to use the most state-of-the-art products in our program. And we also have access reports, again, to show that there'll be very little disruption, that the majority of the membership, their current provider, if they're a hearing aid wearer now, will probably already be in our network because we have a very robust network. If they're not, we are not at all objective to signing them up. As long as they meet our credentialing requirements, we will sign the providers up. We have a current book of business of most individuals in our program are receiving services in network, and we have less than a 1% out of network utilization. Here are those top 6 manufacturers that are referred to. In the industry, Oticon, Widex, Phonak, Starkey, Signia, and Unitron are the top 6 manufacturers in the industry. Resound is part of Beltone, Audibel and New Ear are also some Starkey products, but 99% of the products and manufacturers that are in the hearing industry are going to be in our network. We also have a comprehensive member services department. Again, we're headquartered in Clinton Township, Michigan. The City of Spokane will have a designated customer service line. All of our calls are recorded for 10 years. We have trained CSRs that will be very knowledgeable about the City of Spokane benefit, and we have non-English translation capabilities. So we are able to accommodate any of your members' questions or concerns through our live call center. We have full reporting capabilities. AudioNet's committed to lowering costs and improving outcomes through transparent and detailed reporting. And we will be sharing this reporting with the City of Spokane to make sure that the members are satisfied. So we do member satisfaction surveys. We have financial reporting that will show how many devices were purchased, what the charges were, to make sure that AudioNet is living up to their contractual arrangements with the City of Spokane and providing the membership the pricing that we have agreed to and outlined here. Utilization reporting and ad hoc reporting, we'll work with the city if there's something specific that they're looking for us to report on that is not located in our standard reporting deck. We have full TPA services. This is very important so that you know that your personal PHI is being held in the utmost cybersecurity and insurance regulatory guidelines. We protect your PHI. In most cases, we're handling individuals' names and addresses and social security numbers, and we follow all of the high-level insurance mandates that are required through what we refer to in the industry as SOC audit reporting. And so all of that is held in extremely confidential servers and backups in our systems. So we handle the eligibility file. We will manage the provider network. We process and pay all the claims directly to the providers. We have a national and regional sales and service staff. So if you'd like us to be on site for any open enrollment meetings or health fairs that you may have, we have the accommodations to be able to help in that regard. And again, we have a live member call center. So it's not going to be transferred to another part of the country or a different state. AudioNet is going to answer your phone right here in Clinton Township, Michigan. All in all, AudioNet brings everything related to hearing under one umbrella or one roof. And we feel that we're the missing piece of the puzzle to capture all of these services together, again, collectively. I'd like to now refer over to Rebecca and have her pull up a sample of the benefit summary. And again, just to show you that you will see this online, you will have access. And here it outlines the benefits in detail. And again, what your cost will be. so you know your costs before you even go in to see the provider. And you'll see that your costs are based on different hearing aid levels. I'd also like Rebecca to pull up our product grid. This is also online for all of your members to view. And in the product grid, you'll see at the very top there that the level is defined. So here it defines mid-level, mid-high, advanced, and flagship. When we put this online for City of Spokane, it will also list what your cost is, where it says see plan design. We're going to put right on there what the cost is to the member for these devices. And you will see that we have over 400 products to choose for your provider and members to choose from. So unlike a lot of our competition, we are not limiting the product selection. The product selection is based on those 6 major manufacturers that I spoke of, and these are all their various product names. And so again, you can have access to that by logging into AudioNet America and signing into the City of Spokane website. Also, I'm going to have Rebecca pull up the provider directory and just scroll through very slowly so you can see we have a pretty broad selection of providers in the City of Spokane and surrounding areas. Again, if your provider is not located on this provider directory, but you feel that they, or they state that they can adhere to our credentialing requirements, then we are more than happy to try and sign them up directly in our program. So they would need to meet our credentialing requirements and accept our fees as payment in full with no balance billing to the member. And I think we've got about how many pages there, Rebecca? I think it was, I think we're still going here. We've got maybe, there's probably about 20, 30 providers on each page.
Oh my.
And we've got about 12 pages. So pretty extensive panel of providers to choose from.
And I apologize, this is Terry, but that didn't come up on the screen. Did you intend to share it?
Oh, yes. We've been scrolling away over here. Thank you for pointing that out. We will once again scroll. There are 12 pages of providers, which include both audiologists and hearing dispensers. And it's a very robust provider network for the city and surrounding areas. And this will be online at AudioNet's website for all of the membership to log into to review. And if a member does not see their provider on this list, they can simply call our 800 number and we can take a look at signing them up and credentialing them right away if they meet our requirements and agree not to balance bill the member over and above our agreed upon fees.
Okay, it looks like this is your Washington providers. And now if you'll keep scrolling, you'll reach the Spokane in a moment. So for Spokane, I see that there are 3 or 4 providers. But throughout the rest of the state, there are the 12 pages worth.
That's correct. And it's very common, Terry, to only have, I don't know how large the city of Spokane is, but it's very common to have about 4 or 5 providers in each city.
Correct.
Is Spokane a very population, a very large?
The city
Spokane is the second largest city in the state of Washington.
Yes, thank you, Dave.
Okay.
So we're about, I think,
I'll give you
210,000 in the city with about 500,000 in the general area.
Yes.
Okay. So 2 things to that point. Again, we will try to credential anyone that is in the city that a member would like us to credential. I will give you an example here in Michigan. Detroit is our largest city in the entire state, and we only have 2 providers in the city of Detroit. So all of the providers are probably on the outlining areas of the city of Spokane. We can double check that after today's meeting. And we can also do kind of like a provider disruption report and see if we can find other providers in the city of Spokane directly and try to reach out and contract them right away.
And my guess is
But I would,
you'll work through our HR department and Teresa Collins on updating any new information so it gets on our city's website. So we'll encourage all employees and MMP members to contact HR if they have any questions after this meeting.
okay, thank you.
Yeah.
Can I ask, do you have any idea how many of your employees work in the city or live in the city proper?
Teresa, I don't. Maybe Teresa Collins can tell us.
Okay. All right, we can do that and we can run a report. And like I said, we'll specifically target providers in the city if there are any. Yeah, you know, usually we try to get as many as we can.
So is that the end of our AudioNet presentation?
I believe so, yes, unless you have, if you'd like any questions or.
I was going to suggest that we go ahead and open it up for questions and answers.
Okay.
So anybody who wants to propose a question, go ahead and unmute yourself. And if by chance you're asking away with a question and you haven't unmuted, we're not hearing you. Well, I'm not seeing any questions. So
Okay.
I will have Sam stop the recording, and I want to thank you a great deal for the presentation.